Hello, good evening. Welcome to our regular Tuesday slot. I know there's a few people that are being challenged with power issues tonight, um, but obviously this is being recorded and you will receive a copy later. And if you don't, please let me know so that I can send it to you. So we've been covering the last couple of sessions on labels and how to read labels, what to look for, what is the important stuff. And also we've been covering a little bit of portion control and how portions of food have changed over the years, which was quite scary. So tonight I'm going to be wrapping up. And so I think I'm going to start just with the last slide that I started with the last time, which was sweetness, and then go through and wrap it up. So it shouldn't be too very long tonight. Let me just get all my goodies together over here. And get me down out of the way. Don't need that. Okay, so as I said, we've been covering how to read supplement labels, and also not just supplement labels, but food labels in general, and also food additives. And last week we covered mostly about portion control and how it's changed so dramatically over the years, and then also what we need to do to burn off those excess calories. So we ended off on the sweeteners, and as you can see with this little chemical structure over here, glucose is natural sugar basically, and the bottom part is aspartame. Both are sweet, but they are structurally very different. So the top one is nature-made, the bottom one is man-made. Quite a big difference over there. And sweeteners include intense sweeteners such as acesulfame K, aspartame, and stevia. Now, stevia does come from a plant, so it is considered natural. And they have a sweetness many times that of sugar, and are therefore used in small amounts in things like soft drinks and sweetening tablets. If you've ever looked at those sweetening tablets, they are minute little things, smaller even than the vitamin D. Bulk sweeteners are things like sorbitol, which have a similar sweetness to sugar and are used at similar levels. Now, sorbitol is often used in sugar-free chewing gum and sweets. Now, me being the skeptical person that I am, whenever I see something that says sugar-free, I immediately go and have a look at the label to see what they have replaced the sugar with. And is the replacement better or worse than the sugar that they've replaced? Because that can also be a bit of an issue. So we also have things called acids, bases, and buffers that they use. And this controls the acidity or alkalinity of food for safety, as well as the stability of flavor. Remember that food science is a science, and they have pretty much perfected this science to almost get us addicted to certain types of foods, because they put in just enough of the sweeteners and things that sort of tricks or encourages our body to want more and more and more. And this is where the problem comes in, because now your calorie consumption goes through the ceiling, and you're not, because you're feeling tired and listless because of all this excess sugar now, you don't have the energy left to partake of exercise. The other thing that they put in a lot of foods is anti-caking agents. If you live at the coast and you leave your sugar out on the counter, I think you get a pretty good idea, or your salt for that matter, you get a pretty good idea of what happens to those objects if they don't have things like anti-caking agents in them. becomes a bit of a solid mess. Anti-caking agents ensure the free movement or flow of particles, such as in dried milk or table salt. They don't really have this in your grinder salt, but in the normal table salt, they do put in these anti-caking agents. Then there's anti-foaming agents, which prevent or disperse the frothing, such as in the production of juices. Because if you have it done naturally and you pour it in, it foams up quite dramatically. So they put in these anti-foaming agents to settle that. And then a common one in things like sweets, and scarily enough, also a lot of supplements, not ours, but a lot of supplements contain glazing agents, even medication for that matter. Glazing agents provide a protective coating or sheen on the surface of foods, such as confectionery, and this is for the appearance and shelf life, because you don't want your candy or your sweet looking as though it's about to biodegrade. You want it to look nice and shiny and smooth. And to do that, you've got to put a glazing agent on there. Now, the other things that they use are emulsifiers, stabilizers, gelling agents, and thickeners. Some of these things, the natural versions, are lecithins, and this is found in egg yolks, which obviously is natural, and soya beans. Lecithin is also found in mealies or corn. Now, emulsifiers help mix ingredients together that would normally separate. Think of oil and water. You put an emulsifier in there, they will come together. If you don't, they separate out. And this is why things that don't always have the emulsifiers in them will tell you to shake well before using, because that way they can leave out the emulsifier, but then the product separates. But lecithin, or E322, is a natural emulsifier. And stabilizers prevent ingredients from separating again, such as, it was something I'd never heard of, a locust bean gum, which is a galactomannan vegetable gum extracted from the seeds of the carob tree and used as a thickening agent in food technology. And this you will see represented by the sign E410. Emulsifiers and stabilizers give food a consistent texture, and they can also usually be found in low-fat spreads. So, in other words, margarines. This is why you need to read the labels. Gelling agents are used to change the consistency of a food, like pectin, which is E440, which is used to make jam. And thickeners help give food body and can be found in most sauces, because I'm sure you wouldn't be very happy if you poured a sauce out and it was rather watery and clumpy and wasn't nice consistency as we're familiar with, because you use sauces and you use all these foods and you're familiar with how it looks, but you forget about what they are using from a food science or food technology perspective to keep that food looking like it does in the photos consistently for every single batch. So now, after all this bad news, the big question is, who can we trust? Because we often see in the news these days, and if you look carefully, you'll see them in all sorts of different publications, that hidden dangers lurk in over-the-counter supplements, for instance. So it's not just food, it's also supplements. Now, as we know, a lot of people are looking for supplements these days. They're looking to get away from medication. Now, medication also is put together with a lot of these same fillers and things, but they don't have to put it on the label. So often we see these, or we receive these things if we're taking medication, but we're not really aware of it. And researchers found that from 2007 to 2016, 776 products marketed as dietary supplements contained hidden active ingredients that are unsafe or unstudied. That is a very scary thought. So, how to tell what is safe? We have an idea of what to look for. What more do we need to look for if we are not able to do our own research? Fortunately, there are numerous independent associations that regularly do research on nutrition products. The USDA, for instance, which is the Food and Drug Administration, is responsible for protecting the public health by ensuring the safety, efficacy, and security of human and veterinary drugs, biological products, and medical devices, and by ensuring the safety of our nation's food supply, cosmetics, and products that emit radiation. So they're doing a pretty good job, but there's a lot of things that slip through there because they don't really fall under the USDA at all. Now, there's another company called the International Life Sciences Institute, which is a global non-profit federation dedicated to generating and advancing emerging science and groundbreaking research to ensure that foods are safe, nutritious, and sustainable, and that they improve planetary and human health and well-being in the 21st century. There is also the New York Academy of Sciences, and their mission is to drive innovative solutions to society's challenges by advancing scientific research, education, and policy. Then there's the Federation of American Societies for Experimental Biology, or FASEB, which was founded in 1912, and it began with a small group of dedicated scientists from 3 independent organizations who wanted to provide a forum for educational meetings, develop publications, and disseminate results of biological research. Now, the nation's largest biomedical coalition, comprising of 28, or now it is the nation's largest biomedical coalition, comprising 28 scientific societies and more than 115,000 researchers worldwide. The FASEB is the recognized collective policy voice of biological and biomedical researchers. And then there's one that we're very familiar with, the Scientific Advisory Board. Founded in 1976, they sit at the helm of Neolife's product strategy and development, ensuring each and every one of our leading-edge formulas are based in nature and backed by leading-edge science, using only the finest and the safest ingredients. The SAB is made up of world-class doctors, scientists, and health experts who share our commitment to end the trend. Now, we need to know that the SAB isn't just the, I think it's now 12 or 13 people that we see on a regular basis at any presentation because we see their faces. Every single one of those people is a top scientist in their individual field, be it clinical nutrition, be it food technology, be it biology, sports science, sports nutrition. They are top people in their fields, even product formulation, by the way. But they, in turn, regularly stay in contact with these other places that I've mentioned. They share research. They speak to other top scientists in their fields and collectively bring all that information to give us the best products available. I'm going to briefly stop this presentation for now because there was something I forgot to do when I started sharing my screen, which I need to now do because I need to do this. So we need to know that The SAB is obviously our main filter, for want of any better terminology to use, but they don't operate on their own. They operate in conjunction with a huge number of people that we are completely unaware of around the world. And they linked to top world-leading universities who are busy with frontier research continuously. So if they want to know something about a particular food or something along those lines, they will go to that person who is leading that particular research anywhere in the world. And obviously, they contribute their own research to these places as well. Whenever you see a scientific letter that's being published, right at the end, there's a whole lot of fine print, which is where they got the research from and who the authors were. Now, if you take the time to do deeper research on a lot of these things, you will find some of our scientists mentioned over there in that published research. Things like the omega-3s. We have Dr. Anna Karugi. She contributed a lot of research over there. And there's numerous others that you'll find in various different places if you do that extra research. So these are some of the signs that you need to look for, the logos that you need to look for, things like the USDA, the ILSI, New York Academy of Sciences, the FASEB, and obviously the SAB. Now you will see on every single one of our products, be it nutrition, be it skincare, be it cleaning, you will always find the SAB, which is our particular independent research group. But as I said, they in turn link their research and they share research with all these other top places. So that has always comforted me, knowing from a medical background what research is like. But it's always comforted me that we have all of this science to back up everything that they say. Every single thing that the SAB comes up with and publishes for us, there is numerous references as to where they got that information from. And even with Dr. Jim McAfee, you will see all of his newsletters also has that footnote at the end of it explaining where all of his research comes from. And I'm going to just play this for you now.
What if I told you there is one thing you can do right now that could substantially improve your health and your future? Curious? Good. Skeptical? Great. Here's the answer. Get more whole food nutrients into your cells. How do you do that? Eat better? Well, yeah, absolutely we need to eat better. Many of us try, but there's more to it than that. Studies say that eating as healthy as you can, it isn't enough. This study, and this study, and even this one. We have to go beyond the nutrition on our plates and supplement our diet. Do you take supplements? Do you trust supplements? Do you have a cabinet full of supplements and wonder, are they even working? Are they absorbing? Is there something that you're missing? Or more importantly, could they actually be harming you? Over 75% of us take dietary supplements, and guess what? It's not helping. We're still getting sicker. Chronic disease is still on the rise. So here's the question. Is it important to take vitamins and supplements, or is it important, along with a healthy lifestyle, to take in true whole food nutrients that have been clinically proven to help restore cellular function, bridge critical dietary gaps, and reverse the root causes that can lead to major health problems such as inflammation, which, by the way, is the main cause for most diseases like these? And is it also important to boost immunity? So let's review. You want to improve your health. Leading doctors, scientists, and studies say that we're lacking proper nutrition. And the multi-billion-dollar supplement industry is bombarding you with confusing options and big, unsubstantiated promises. No wonder you're skeptical. As a smart consumer who cares about your health, you should be. So what do? Tighten your criteria and start with credible science and whole food nutrition. Before you buy one more supplement, here's a checklist of 5 key criteria. Number 1, whole food. Are the nutrients just natural? You know, sheep wool, algae, duck feathers. Yeah, all that stuff and more is used by other companies. Probably not the type of natural you want to put in your body. Or are the nutrients in the products derived from real whole foods found in the human body? Are they grown, sourced, and developed with the highest known organic and non-GMO standards, sustainably, and most importantly, nutritionally effective? Number 2, credible science. Okay, this is where you get to be a super consumer. There are lots of products that are claiming to be tested for purity, clinically researched, clinical grade, doctor recommended, even claiming to be clinically tested. But that doesn't mean that the actual product with those specific ingredients underwent an independent, third-party clinical study on an actual population with evidence-based outcomes. And then, were those studies published in respected medical journals that have rigorous, independent peer reviews, and not just pay-to-play journals that have impressive-sounding names? Number 3, integrity. Red flags, lawsuits, dangerous warning labels, and alarming reviews. If these exist, then there's probably an issue with either the integrity or the competency of the company. So what's the goal of the company? Is it to truly help people end the trend of chronic sickness and disease, or is it to simply capitalize on a fad in the rapidly growing supplement industry? Does the company maintain a third-party pharmaceutical drug license? And is the company registered with the FDA and operating under their regulation? Is there oversight to ensure that what's on the label is actually in the product, which, by the way, is not required for supplement manufacturers? It is a choice of integrity. Number 4, longevity. Do you know the origin story? And do they still hold to the same values today? How long have they been around? Are they privately owned, or are they publicly traded and seem to care more about stock prices than product quality? What do people say about their experience with a company and their products after 10 or 20, or better yet, 60 years of use? Do they have a high rating with the Better Business Bureau? Number 5, a guarantee. If a company truly has confidence in their products and the benefits they provide, they will offer a money-back guarantee, and they will seek to serve the community by offering outstanding customer care. We hope these 5 criteria will empower you to be a more informed consumer. We'd like the opportunity to introduce you to the only company that I know of that meets and exceeds all 5 criteria. And you've probably never heard of it. They started more than 60 years ago with a clinical hospital study using a breakthrough product that was proven effective at the cellular level. Wouldn't you want to get up to 50% greater nutrition utilization from your foods? Listen, you can spend hundreds on healthy foods each month, but if your cells aren't functioning properly to receive those nutrients, then you might be wasting a lot of money. This is important because who wouldn't want to use up to 50% more nutrition from their food? This company's reputation for scientific excellence is so well established that their products have been used by researchers from the CDC, USDA, just to name a few. They are known in over 50 countries globally. They aren't interested in just closing a deal or only selling a product. They are committed to improving your cellular health through clinically proven whole food nutrition. They are a socially responsible company on a mission to make the world a healthier and happier place through superior quality whole food nutrition, organic skincare, and healthy living home products. If you or someone you know would like to take a deeper dive into this company, their products, and the clinical results proving that they actually work, then please contact the person who shared this with you.
And that is the end of that. Does anybody have any comments or questions before I stop the recording? Okay, let me stop.